Hi everyone, my name is Kate Lewis.
I'm Denali Lazama.
I'm Nadia Zappian.
Alasia Cross.
And I'm Jeremy Martinez, and we're talking about Edwards syndrome. Uh, the prognosis for trisomy 18, also known as Edwards syndrome, is a genetic disorder characterized by the presence of a extra chromosome 18. The additional genetic material disrupts the normal developmental process of the body, leading to a wide range of physical and cognitive abnormalities. Despite extensive research, the exact cause of presence of an extra chromosome 18 remains unknown. Studies have shown that only 50% of babies who are carried to term will be born alive. The median of survival among live births has varied between 2.5 and 14 and a half days. About 90 to 95% of babies do not survive beyond the first year, and many live only a few days.
And I'm going to be discussing the history. So, Edwards syndrome was discovered by John Hilton Edwards in 1960, pictured to the right. His research noticed that a newborn with various congenital issues and defects were present. The prevalence has grown due to an increase in average maternal age. So, as known, the maternal age has grown over the course of many years. And the name of trisomy 18 has originated from the disease having a third cell attached to the 18th chromosome pair, as Jeremy was discussing earlier.
So going off of what Kate said about the extra chromosome, I'm going to be discussing the causes of trisomy 18. And in biology, all humans have 46 chromosomes, those of which will divide into 23 pairs. So there's going to be 2 in each. And the chance that a chromosome does not divide can result in 3 copies on chromosome 18, which you can see on the image to the right. On number 18, there's that red X, which represents the extra chromosome. And then this is there's an unknown cause. It's random and unpredictable. You won't know until you know, which there is no cure for it. And the chances do increase with maternal age, but again, you won't know if you get it until you get it.
So now I'm going to be discussing the people at risk of Edwards syndrome. Like Jeremy and Denali both mentioned, there are no known risk factors. The genetic mutation is a birth defect by pure chance. As Denali stated, it's not, you won't know until it is diagnosed. It's not inherited, so you can't genetically inherit it from a past family member. And previous pregnancies with Edwards syndrome can increase the chance of following pregnancies involving Edwards syndrome. And family inheritance can happen from a parent who might have a chromosomal abnormality. It might not have to be Edwards syndrome, but it could be any chromosomal abnormality. Approximately 1 in 6,000 live births have Edwards syndrome in the US. Few infants live past 1 year when diagnosed with Edwards syndrome, and approximately half of those affected newborns live past 1 week.
So now I'm going to be discussing the signs and symptoms. So a little background information, signs are going to be what can be seen by the physician or on an ultrasound or any other exam. And then the symptoms are going to be what's felt by the patient, or in this case, the mother or the fetus. So starting with signs, there's going to be a decreased muscle tone that you're going to observe in the baby. Overlapping fingers, which there is another slide with images as examples. There's a small head, which in my term is microcephaly. A cleft palate, the baby will present with a weak cry. And then there will also be defects in the heart and lungs, as well as many other organs of the body. And then they're also going to have a low set of ears, which there's also an image so that you can see what that looks like, and deformed feet, which can also be referred to as rocker bottom feet. So with symptoms, there's going to be little fetal activity felt by the mother. and then there's going to be a small placenta, as well as heart and kidney diseases that are going to present at birth. And then through an ultrasound, you can see too much amniotic fluid. And I'm going to go ahead and slide to the pictures, which I'll leave up here for a little bit. But going from left to right, there's the cleft palate, the overlapping fingers, and then the rocker bottom feet, and the microcephaly. And most of these are going to go along with trisomy 18, also known as Edwards syndrome. It's just more of this combination that is kind of reserved to this specific disease. And I'm just going to leave these up here for a few more seconds just so that you can kind of really see and can tell apart the disease.
Okay, I'm going to be talking about environmental factors. So although there has not been any environmental factor that have been identified to cause trisomy 18, there have been many studies that suggest certain environmental factors may increase the risk of trisomy 18. So these environmental factors may increase the possibilities of chromosomal abnormalities. So some of them include occupational hazards. So this includes anything associated with working in a specific occupation, physical and chemical factors, personal habits, ionizing radiation, so X-rays, chemical mutagens, so this would be tobacco products, radioactive substances, X-rays, and ultraviolet radiation, heavy metals, pathogens, so this is basically an organism causing a disease to its host. Okay, so for the prevention, so as mentioned before, Edwards syndrome is a genetic disease, which means that there's no way to prevent someone from getting this, or in this case, a baby being born with trisomy 18. So this condition usually does not run in families, therefore it's not caused by anything you have done or like the parents have done. This is a result of genetic mutation. So this happens, as mentioned before, when there are changes to your DNA sequence during your cell division. This being that you have 3 copies of chromosomes number 18 rather than 2 copies of the normal number. In this case, the changes to the baby's DNA sequence make Edwards syndrome the result. So healthcare providers do suggest that if you are planning to become pregnant, to speak with your healthcare provider about getting genetic testing done to rule out the risk of having a child with Edwards syndrome. Okay, so this is just continuing on the prevention. So if the option is available to you, there is a combination of genetic testing and in vitro fertilization that you can have done. Basically, what this means is pre-implantation genetic testing. So it's vitro fertilization is a procedure in which eggs are removed from a woman and combined with the sperm outside of the body to form embryos. The embryos are grown in a laboratory for several days and then either placed in a woman's uterus or frozen for future use. Vitro fertilization is used by some to avoid passing genetic diseases to their children. So if your partner knows that they have some chromosome abnormalities and they want to just make sure their children don't get it, they'll lean towards this. Okay, so if you do qualify for vitro fertilization implantation, genetic testing is recommended by your healthcare providers just to make sure you rule out all those possibilities of your child getting Edwards syndrome. So the benefits, just as again, ruling out the possibilities of transferring an embryo with possible chromosome abnormalities or genetic conditions. Also, genetic counseling is recommended for the parents who have children with this syndrome and are considering having more, just so they're informed of what to expect. Okay, and then by taking into consideration these important recommendations, you can reduce the possibilities of having a child with Edwards syndrome prior to pregnancy.
Okay, so the treatment for Edwards syndrome, since there is no cure for Edwards syndrome, there are treatments that are used for the comfort care of the individual. Heart issues affect almost all children with Edwards syndrome, and depending on how severe they are, they may or may not be suitable for heart surgery. Diuretics and digoxin are medications that can be used to treat heart failure or irregular heartbeats. They also have problems with feeding and nutrition. Nutrition is a problem with children that have Edwards syndrome due to their delayed physical development. They suffer from eating issues at birth. In order to treat these problems, feeding tubes are used. There are two types, gastrostomy or nasogastric, which is one is in your stomach and one is in your nose. Having these feeding tubes also can cause gastroesophageal reflux, also known as acid reflux, which is characterized by symptoms such as nausea, regurgitation, and burning of the chest. Medical therapy is used to treat this, but if symptoms persist, surgery is required. They also suffer from orthopedic issues. Children with Edwards syndrome suffer from hemivertebrae. This disorder is when only one side of the vertebral body develops. This results in scoliosis and lateral curvature of the spine that affects the child's gait. These spinal problems can be fixed with back braces, but in some extreme situations, bone grafting and spinal fusion procedures are required. Children with Edwards syndrome also suffer from a lot of different infections. They're very common. Children with Edwards syndrome are susceptible to a variety of illnesses, including urinary tract infections, lung infections, pneumonia, and ear infections. Antibiotics can be used to treat any of these infections, curing them all. Parents need to keep an eye out for any potential infections in their children.
Public health efforts for trisomy 18 are currently limited, primarily encompassing two programs, Cards of Hope and EWE. Cards of Hope believes that sending a card of hope will help the families and the babies affected fight this disease and be surrounded with love and positivity, and they believe that the power of love and positivity can work wonders and help with this disease. The EWE Foundation brings light to Edwards syndrome and other rare diseases not widely known. And they help by supporting affected families and giving packages to families to help with the infants being affected with Edwards syndrome.
Okay, so here's some other facts. So most of the babies that are affected are girls, although it's not just limited to them. Girls are the ones that are mostly affected. 50% of babies who are carried to term will be born alive. Around 90 to 95% of babies born with this syndrome do not survive beyond their first year. 90% of infants with Edwards syndrome have congenital heart defects.
And then also there are 3 known types of trisomy 18. So we're gonna have full trisomy, which is an extra chromosome in every cell of the baby's body. And this does happen to be the most common type. And then there's also gonna be partial trisomy, which only has a part of an extra chromosome 18. And then after that is mosaic trisomy, which is an extra chromosome in only some of the baby cells. And this is the most rare. Again, the most common is full trisomy. And these are only the 3 known types because this disease isn't really studied and it's very like unknown still.
So as Denali was mentioning, this disease is very uncommon to people. They don't know a whole lot about it. So we wanted to bring more awareness to Edwards syndrome and to just educate y'all on this disease and to learn more about it. So we appreciate y'all for taking the time to watch our video and learn more about Edwards syndrome with us. We really enjoyed researching for this disease and being able to provide more information for y'all. Thank you.